It's been 6 months since Pine Rest opened the first Psychiatric Urgent Care Center in West Michigan. And today, Megan Zambiasi, the center's director, joins me with an update on how things are going. Good morning. It's good to have you here.
Good morning.
Tell me a little bit about, for folks who haven't used it or known about it, tell me about the urgent care and why you decided to open this.
Right. Well, the urgent care is something that we heard from the community for quite a while, that we needed to have a better way for people to access psychiatric services in the moment that they needed them. Typically waits can be pretty long, several months sometimes, for people to get in to see a mental health professional. So we wanted to have something that was available in the moment you decided it was that time, especially if you had symptoms that were more severe and were preventing you from going to work or enjoying your activities, things of that nature.
So as you look back on this start for you, tell me a little bit about, is it a success? Are people using it? What are you learning?
Yeah, absolutely. We've been really pleased actually by the community response. Like I said, people asked for it, and sometimes when you open something, you're not sure. But absolutely, we've had great response. We've seen about 3,000 people so far in our space, which for that kind of service is quite a few. And they've come from all over, mostly from Kent County, but also from almost all the counties in Michigan, other states.
Which that really surprises me, that they'd come from, well, elsewhere in Michigan, but then to hear out of state.
Yes. Yeah.
Just because this doesn't exist anywhere else, you're really kind of pioneering it?
Correct. There aren't very many urgent cares anywhere in the country, is what we found out. So.
Can we identify anything else about sort of a typical patient for you? Who's presenting?
Oh goodness, typical patient. Well, probably one of the things that we found is that people tend to be a little younger, at least right now. We're serving people between the ages of 18 to 65 in the urgent care, and they tend to be actually between 18 and 36. That's the most common age range, and it was really interesting to us that that happened. So one of the things that people tell us is that it's easier. It's easier to come in, and that has been serving that group quite well. Many of them are earlier in their careers, maybe don't have as much time off.
Any kind of common reasons that they're coming?
Yeah, absolutely. Often anxiety and depression. Anxiety is probably our most common reason that people arrive. That and panic attacks, things of that nature. But we've seen people for a variety of concerns.
What can folks expect who do decide that an urgent care visit is in order?
It's a lot like a medical urgent care center, really. When you come in, you see a medical assistant, a social worker, a advanced practice professional, so a nurse practitioner, or a psychiatrist, and all of those people are there to help assess you, try to figure out what it is that you need for your next step, and then we get you an aftercare treatment plan and go to that next place. So
a lot of folks may consider whether it's appropriate to go to the urgent care, just as they do with a healthcare visit.
Right.
What do you recommend they do if they're kind of wondering whether they're appropriate for that?
Right. We actually have a really great guide on our website, so I would direct people to go to our website and take a look at that. That's very helpful. But in general, if you think behavioral health similar to medical urgent care, it's those needs that you wouldn't go to the emergency room. You don't need medical care, but you are really kind of suffering, need something right away. Well, that's probably the sweet spot.
All right. Well, if you'd like to learn more about the Pine Rest Psychiatric Urgent Care, you may do so on our website, 13onyourside.com. Thanks for watching, and thanks to you for being here.
All right, thank you.
Bye-bye.